Good evening, everyone. Welcome to tonight's webinar. This is Wendy Fournier, President of the National Autism Association. We are thrilled to welcome a very special speaker with us this evening, Dr. Ron Aung-Din, who has practiced general neurology and neuropsychiatry in Sarasota, Florida for over 25 years. Dr. Aung-Din is board certified by the American Board of Psychiatry and Neurology and is a member of the American Academy of Neurology. I'm going to let him jump in here in a minute and tell you a little bit more about his background. I just want to say that we have had an enormous amount of interest in the topic of cannabinoids, and I'm very happy that we can finally bring this topic to you all through our webinar program. We are recording this webinar, and it will be posted on the National Autism Association website within the next day or two. So if you want to share it with someone who may have missed it, you'll be welcome to do that. If you look at your GoToWebinar control panel, you'll see a section that's labeled questions. There's a little drop down arrow there. If you have a question at the end of the presentation, please go ahead and type it in there. Dr. Aung-Din is going to be around to answer some questions for us after his presentation has finished. So feel free to put those in there. And we're just going to go right ahead and get started. Dr. Aung-Din, when you are ready, please let everybody know just a little bit about you, kind of introduce yourself if you don't mind. And we are very ready for your presentation. Thank you so much for being with us tonight.
Thank you very much, Wendy. And good evening, everyone. Thank you for joining us in this very interesting and complex topic. The topic tonight is endocannabinoid system, that is medical cannabis, medical marijuana, and neuromodulation, the potential of cannabinoids in treating autism. As Wendy said, I practice neurology and neuropsychiatry in Sarasota, Florida. Just to give you a little background, I did not start out as a doctor. I was an engineer first, a mechanical engineer, then decided that the human body was the most amazing machine. So I went into medicine, University of Texas Southwestern Medical School in Dallas, Texas. Then I thought I wanted to be a heart surgeon, but then I got swayed into the brain and did neurosurgery for 5 years of residency and then neurology for 3 more years. But I determined that I was really meant to be a neurologist and not a surgeon. So that's what I've been doing for the past 25 years or so in Sarasota, Florida. First of all, I know that we probably have a very wide spectrum of audience. Some probably maybe professionals and even medical professionals who know medicine and the human body, and some may be just caretakers and moms and dads and even patients. So I want to be very basic so that I cover everything. I don't want to talk over anybody's head. And for that reason, please excuse me if I seem to be a little basic. But this is a very complex and intriguing topic, and I want to make sure that you all understand it. Let's talk about some basic facts about the human brain. It comprises about 2.5 pounds of the most complicated substance known to man. It's about 2.5 pounds. And it consists of 80 to 100 billion neurons. The neuron is the main cell, and it works through electricity and chemistry. To give you an idea of what 80 billion is, the world population is 8 billion. So it's 10 times the world population of neurons in your brain. The brain serves as the main computer for processing nerve signals and for outputting them for the body's functions. It has plasticity, which means it has capacity for reprogramming and significant reserve. In fact, people have said that we only use 15% of our brain. So it appears to be purposely over-designed. And that's why we can capitalize on treatments to reprogram the brain to make it do things that it was not able to do before or was not doing before. Now, how does the brain function and what is neurotransmission? The brain controls all human function. We think about sight, movement, sensation, but it also includes thoughts, emotions, intentions, our behavior, processing and interpretation of sensory phenomena, which in autism is very important because, as you well know, autistic kids have a difficulty with sensory phenomena, not just sensation, but auditory and so forth. The brain communicates through chemical and electrical processes because the neuron serves its function through chemistry and electrical activity. chemical neurotransmitters, you probably heard of serotonin, dopamine, norepinephrine, acetylcholine, and others, are released at the neural synapse. The synapse is just another name for a gap between two communicating neurons. So when neurons communicate and send signals, they have to traverse that gap through neurotransmitters being released and bound. As a neurotransmitter binds from one neuron to another through the synapse, it results in an electrical impulse called the action potential, causing neurotransmission and therefore communication from one cell to another to do what it's supposed to do. So neurotransmission is the basis for the function of the neurological system. On the left-hand side, I'm showing you the communication between neurons. There's a sending neuron. In other words, that is sending impulses to the receiving neuron. And you see that it is sent through electrical impulses along the axon. Every neuron has just one axon, but it has hundreds of dendrites, maybe thousands, and the dendrites serve as receiving terminals. So as you can see, as you follow that axon down, the axon branches and connects onto the cell body of the other neuron as well as to the dendrites. Then in the lower picture, where the arrows are, the red arrows, you can see the synapse, particularly on the right-hand side. See the synaptic cleft, how one neuron releases neurotransmitters, and that goes through the synapse and binds to the receptors on the receiving neuron at the dendrite. That being said, dysfunction or abnormalities in brain chemistry can cause certain diseases and symptoms. In fact, they're very specific. You've heard of Parkinson's disease. Parkinson's disease is caused by a deficiency in dopamine. And also chronic fatigue syndrome can be caused by deficiency in dopamine. A deficiency of the neurochemical acetylcholine, particularly in the middle of the brain, in what they call the mesial forebrain, can cause memory loss and other symptoms of Alzheimer's. You've heard of serotonin and depression. Decreased levels of neurotransmitter serotonin and norepinephrine can cause symptoms of depression and anxiety. They can also cause a greater perception of physical pain because the same neurotransmitters of serotonin and norepinephrine subserve emotional and physical pain. Some of you realize that when you're in emotional pain, you're depressed. When you have a physical pain, you perceive it more. And when you have physical pain, your body's telling you something's wrong and you don't feel so good, so you get depressed. So the two go hand in hand. Symptoms of attention deficit disorder, ADD and ADHD, can be treated by increasing the neurochemical norepinephrine in the frontal lobe. Increased dopamine levels in certain parts of the brain can cause psychosis and OCD behaviors such as addictions and gambling. So what I'm trying to tell you is that brain chemistry has a very important part in how we function as human beings. Now, so does abnormal electrical activity can cause specific symptoms. On the top picture, we see seizures. Abnormal brain activity can cause seizures, inattention, mood swings, strange sensations and perceptions. They call them auras or hallucinations. And all they are abnormal electrical discharges in specific parts of the brain. The upper picture shows a person who's had a stroke on the left side. And you can see there where the black arrow is, there's an electrical discharge of seizures. And that person with that left frontal seizure focus is noting right hand numbness, tingling, and shaking. Very specific symptoms. The lower picture is even more stereotyped and specific. It is what we call 3 per second spike and slow wave focus. As you can see where the two little arrows are, the brain waves become abnormal and they fire at 3 per second spike and slow wave. And that particular characteristic is in absence seizures where kids just stare off and they come back. Very specific, and there's a very specific treatment. This particular recording is from an 8-year-old patient with absence seizures. So in summary, abnormalities in brain chemistry and abnormalities in brain electrical activity, specific electrical activity as well as specific areas of the brain being affected, can cause very specific symptoms. So as far as autism symptoms, altered brain function can become the basis for the symptoms of autism. The signs and symptoms of autism suggest problems in brain processing and output as a result of abnormalities in brain neurochemistry and electrical function. And this may be reflected in the EEG. The EEG, or electroencephalogram, is an objective indication of brain electrical activity and is measured through electrodes placed on the surface of the skull. A normal EEG, however, does not indicate that there's not an electrical problem, as episodes such as seizures and other abnormal electrical activity can be episodic, occurring intermittently. So it's just a picture in time. If I take a picture of you not smiling, doesn't mean you don't smile. It's just that at that time you weren't smiling. So we have to take an EEG in light of the whole clinical picture. Here is a picture of an EEG. We put electrodes on the scalp, and you can see the EEG recording on the right-hand side, and we can detect abnormalities. The brain has two parts, left and right, and it should be symmetric, and the waveform should be fairly regular. When there are irregular discharges, they can be seizures or abnormal activities suggesting brain irritation. In fact, it's interesting that this was an article that just came out in March 29th in Psychological Congress, which says that certain electrical activity noted in the brain waves can predict a patient's response to lithium for bipolar affective disorder. In other words, there seem to be characteristic EEG discharges which can correlate to either symptoms or response to treatment. Let's now go to endocannabinoids, cannabis or marijuana, specifically medical cannabis and cannabidiol or CBD, and how it affects brain function. How does cannabis work? Well, we know it best with a picture on the left in the middle, the plant-derived phytocannabinoids, phyto meaning plant. That's what we all know as weed and grass and so forth because it's a plant. But we can also synthesize it on the right-hand side as synthetic cannabinoids. In fact, there's a drug called Marinol, which is a synthetic THC, which is used for appetite and nausea. But we also produce it ourselves, and they're called endocannabinoids on the left-hand side. In fact, the picture of the gentleman right there on the right-hand side, Raphael Mechoulam, in 1992 discovered that we make endocannabinoids. We make chemical substances that act on the same places that the plant substances act on. And he named them endocannabinoids. In fact, he also named this term called entourage effect, which means that there are many cannabinoids in the plant that when they're put together, they have an effect of an additive effect of function as opposed to when they're used separately. And as you can see on the left-hand side, whether they're endocannabinoids that we produce, phytocannabinoids that we take from plants, or we buy it from the pharmacy as synthetic cannabinoids, they all have to work on our brain and peripheral nerve endocannabinoid receptors. These are CB1 and CB2. In fact, this is a picture of Dr. Mechoulam. Last April, I was fortunate to meet him at the first International Cannabis Medical Conference at the Harvard New Medical Research Institute. And in that lecture, he said, this is just a partial list of some of the symptoms and conditions that cannabinoids work on. Take a look at it. Anxiety, appetite, blood pressure, bone formation, brain blood flow, digestive system, nausea, vomiting, immune system, inflammation, memory, mood, movement, neuroprotection, pain, reproduction, stress. I mean, it's amazing that one compound can do all that. So you're probably asking yourself, how is that happening? And I hope to go into that. What are cannabinoids? And what types are there, and what are their functions? Cannabinoids are nothing more than chemical compounds that act on cannabinoid receptors on the cells in our body. particularly the neurological system, and they influence release of neurotransmitters, among other functions, in maintaining health. So you heard about neurotransmitters already: dopamine, serotonin, norepinephrine. These cannabinoids influence the release of these. THC, or tetrahydrocannabinol, is the primary psychoactive cannabinoid. This is the one that gives you the high. CBD, cannabidiol, is the major constituent that's most responsible for its medical benefits. There are over 100 different cannabinoids that have been isolated from the cannabis plant, each with varied effects, causing the potential for this entourage effect, where 2 or 3 cannabinoids together have a different effect than just one. What are the potential uses, medical uses, for CBD or cannabinoids? Well, since they have a wide scope of medical applications, they can influence, among other things, neurotransmission. Remember, we talked about neurotransmission, how the brain communicates with the body and other nerve cells. Immune function. That's why cannabinoids work in cancer and MS. Inflammation. That's why it works in pain. Cellular homeostasis, or maintenance and function. Cannabinoids are uniquely different from any other neuroactive chemicals in our bodies. Why is that? Because they modulate. Webster's dictionary defines modulation as changing or adjusting things within a system so they exist or function in a balanced or proper fashion or amount. So neuromodulation is merely changing or adjusting things within the neurological system. So we all know that patients with seizures, autism, something is out of balance. And that's why cannabinoids are very unique in their ability to treat symptoms of autism. What are the physiological effects of cannabinoids? They produce physiological and behavioral effects through interaction with specific receptors on cells. There are 2 types of cannabinoid receptors, CB1 and CB2. There seems to be evidence that there are more that exist. The CB1 receptors in the brain, particularly basal ganglia, which is for movement, limbic system for emotion, and hippocampus for memory. CB1 receptors are responsible for the euphoria, feeling good, anticonvulsive effects. That means, again, seizures of cannabis. CB1 and CB2 receptors in the peripheral nervous system are responsible for anti-inflammatory effects such as pain relief. Cannabinoids influence neurotransmitter release at synapses to create neural impulse generation. Again, on the left-hand side, you see the neural synapse. On the top part is the sending neuron, and then there's the synapse, the gap. It's sending off neurotransmitters, which are going to the receiving neuron and binding on the binding sites, and then it causes a neurotransmission. The picture on the right-hand side shows you the concentrations of CB1 receptors in different parts of the brain with different functions. This is the chemical structure of CBD, the medical component of cannabis, or hemp. Let me just say that there is hemp-derived CBD and cannabis-derived CBD. Cannabis is the marijuana plant. Hemp is a totally different plant, but it also produces CBD. So it is a source of non-regulated, in a sense, CBD, because cannabis has been regulated by the government, and we're going to go into that. So cannabidiol, CBD, is the medical component of cannabis and hemp. It works on serotonin and therefore has antidepressant, anti-anxiety, and neuroprotective effects. It modulates opioid receptors, where narcotics work, and so it's involved in pain perception and pain relief. CBD is not psychoactive like THC, and it relieves seizures, inflammation, and nausea. CBD prevents short-term memory loss, which can be associated with THC. The antipsychotic effects of CBD represents a potential treatment for schizophrenia. In fact, there was a study which showed that CBD was safe and well-tolerated alternative treatment for schizophrenia. There was a double-blind trial that compared purified CBD to a pharmaceutical atypical antipsychotic, and acute paranoid schizophrenia. Both worked, but CBD had significantly fewer side effects. Studies also show that CBD decreases symptoms of social anxiety and isolation, and this could be very useful in autism. CBD has antidepressant effects in animal studies of depression. In fact, there are some approved medical uses of CBD and cannabis in the US and Canada. There's an oral CBD formulation which received orphan drug status for Dravet syndrome, which is an intractable seizure disorder known as severe myoclonic epilepsy of infancy. There's another drug, trade name Sativex, which is an aerosolized mist of containing 1-to-1 ratio of CBD to THC, which was approved in 2005 in Canada for multiple sclerosis associated pain. And as I told you, Marinol is a synthetic THC product, which has been FDA approved many years in use for appetite and nausea. Let's talk a little about the history and the science of medical cannabis. Let me just say that up until 5 years ago, I was stigmatized and did not believe in the medical aspects of cannabis. They didn't teach that to us in medical school, and I saw the effects of cannabis, and I thought this is just for people who just want to sit around and be on couches and just smoke weed. But as a result of the resurgence, particularly I give credit to Sanjay Gupta of CNN in his Weed 1, 2, and 3 series, which opened my eyes. He's a neurosurgeon, similarly trained like me, and I said, if he's thinking there's something here, I need to look into it. And I'll tell you my story about how I became a believer and how I saw the light in terms of the medical benefits of cannabis. But this was the National Geographic cover of 2015 June, and it says weed, the new science of marijuana. Then on the right-hand side, it says there's really nothing new in cannabis. It's been around humankind pretty much forever, and that is true. Here's the history of medical cannabis timeline. Literature 4,000 years BC in China was indicating the medical uses for cannabis. Then in 1860, United States, there was the first clinical conference on cannabis that was held. 1850 to 1900, worldwide, there were hundreds of scientific articles that were published on the medical benefits of cannabis. Then 1937, what happened? The Marijuana Tax Act passed, and it required a tax on cannabis, and it became very restricted for use as medicine. Then 1941, it was taken off the pharmacopoeia in the USA. In other words, it was not allowed to be a drug anymore. And I'll go into why that happened. 1970s, 1980s, there was not much work in the scientific area of cannabis. But presently, what's happened is there's been a resurgence in interest because of desperate cases not being met, its needs not being met by pharmaceuticals, such as particularly in seizures. Now, when I started looking at the history of cannabis in America, I was astounded. This was a presentation I went to in Seattle at a medical cannabis conference. And I found out that from 1850 to 1937, when it was taxed, it was the golden age of medical cannabis in America. These are examples of cannabis-containing products made and marketed by U.S. pharmaceutical companies, ranging in cough drops to anything for nausea, for pain, and so forth. Now, what's going to amaze you is this. On the left-hand side, as you can see, it says Indian cannabis or cannabis indica. They were getting cannabis from India, but American ingenuity, as it is, said, why are we getting it from India? Let's grow it ourselves. So 2 American pharmaceutical companies, you probably recognize, Eli Lilly, which introduced Prozac and now Cymbalta, and Upjohn, which became Park Davis and now Pfizer, they joint partnered and grew cannabis americana in Greenfield, Indiana. And there it is on the right-hand side, cannabis americana, homegrown cannabis by U.S. pharmaceutical companies. So what happened? And what is patent number 6630507? Well, as I told you, Congress enacted cannabis prohibition in 1937 and took it in 1941 from the American Pharmacopoeia. And it turns out, what was so special about 1937? Alcohol prohibition was lifted in 1935. And there was this push that, what are we going to do with this ATF, alcohol, tobacco, firearms, and now explosive institution with all these workers? And there was all this lobbying and so forth going on, and they started to pick on cannabis, and they gave it the name marijuana to give it an exotic, derogatory name. And so that's what happened. 1937, they enacted the Tax Act. In 1941, it was completely removed from pharmaceutical use. In fact, it was designated controlled substance category 1, together with heroin, cocaine, and LSD. Controlled substance category 1 says, of no medical use and highly addictive, which, as we know, is not true. Nobody has died from a cannabis overdose, and there is a lot of medical use. So what then is patent 6630507? This was a patent granted in 2003 to the U.S. Department of Health and Human Services, claiming exclusive rights for the use of cannabinoids to treat a wide range of diseases caused by oxidative stress, such as Alzheimer's disease, Parkinson's disease, stroke, heart attack, Crohn's disease, diabetes, and arthritis. So there's a little controversy here. On the one hand, it's controlled substance 1, it's illegal. On the other hand, they have the patent. In fact, my patent attorney looked at their patent, and it does not hold water, because in filing a patent, you have to make sure that you came up with something new and different. And he said, this 6,000 years of prior art, they can't do that. So that being said, we now move to the modern era of medical cannabis. The evidence of efficacy. Efficacy means that it's effective. From 1990 to present, there are at least 60 peer-reviewed studies of medical cannabis, of medical marijuana. And look on the right-hand side, all the disease states. ALS, bipolar, cancer, glaucoma, HIV, Huntington's disease, multiple sclerosis, nausea, pain, Parkinson's, PTSD, psychosis, schizophrenia, rheumatoid arthritis, Tourette's. 68% of the studies were positive, which is pretty amazing. I've done 60 clinical trials for the pharmaceutical industry, bringing drugs to market in MS and Parkinson's and seizures. You don't get those kind of results. Therefore, this is part of the from the National Geographic article. So we have a resurgence after thousands of years of history of a compound out of a clinical necessity. Certain disease states, their needs are just not being met by the pharmaceutical industry. And they're saying this is the marijuana's moment. And the right-hand side, it shows how it's become a grassroots movement from families and people with disease states that are intractable, such as seizures, autism, who are saying we need cannabis to be legalized because our loved ones are not being adequately treated with current pharmaceuticals. Here's a chart of the medical cannabis breakdown by qualifying condition. As you can see on the big green circle, chronic and severe pain, 64%. Most of it is used for pain. And I'm one of the few certified prescribing physicians in Florida for medical cannabis, and most of it is for pain, where people want to get off narcotics and get on something that's natural and won't cloud their brain thinking and so forth. Then there's other things like severe nausea, cancer, PTSD, seizures, muscle spasms. I want to next talk about my own clinical experience with cannabinoids. And as I told you, it's been a personal journey of enlightenment. I was one who wouldn't even hear of it. And through my eyes being opened and seeing the results, I became a believer and now is a proponent of cannabinoids. As Wendy said, I practice neurology in Sarasota, Florida. Neurology is very interesting discipline because it deals with the brain, and the brain controls everything, not just motor and sensory and vision, but as I said, emotion, function, and all that. It's what makes us human. What I realized through the Weed series that Sanjay Gupta presented at CNN was that there was a gap between desperate needs and inexact science. That's what cannabis medicine was when I first started in it. On the left-hand side, we see kids having hundreds of seizures a day, moving to Colorado to obtain cannabis because it's a land of hope and healing through medical marijuana. But as you see the names, things like poison, King Bubba, kamikaze, that just is not very sounding of pharmaceutical and medical drugs. Like anything in life, there are events that occur which change our perspective, and I call them pivotal cases. This was my pivotal case, which made me a believer in medical cannabis, and I'll tell you about it. I was giving a lecture in San Antonio, Texas, and the drug rep that was taking me around, Cynthia, said, "You probably won't see me again." And I said, "Why?" "Because we're moving to Colorado." I said, "Why are you moving there?" He says, "Well, I have a son named Alan, who's now 24, who has intractable seizures, and nothing is working, and we want to go there to get medical cannabis." I said, "What happened to Alan?" "Well, at age 14, he was run over by a truck in a farm accident and has intractable seizures. He's had 5 brain operations, and he has seizures several times a month in which for 24 hours, he's just out. He's had to drop out of college. He's getting very depressed, has been evaluated at all the epilepsy centers, including in Dallas, where I went to medical school, and they said he's not a candidate for surgery or for vagal nerve stimulation, so we're going out there desperate. His prior medications are Dilantin, Carbatrol, Keppra, Lamictal, Depakote, and currently he's on Vimpat and Onfi and still having seizures." And I said to Cynthia, "Before you move, would you have him come to Florida? Because I'm doing some work with CBD from hemp, cannabidiol, in a topical cream delivery that I developed about 14 years ago, and for which I've been granted patents. And it seems to work for neuroactive drugs in treating pain, seizures, and so forth. And I want to try if CBD would work for him." And she said, "Okay." So he came for a couple of days. In June 2014, I started Alan on CBD twice a day. He's been seizure-free for 2 years now. He remains on Vimpat. His on-feed dose has been reduced. And when I repeated the EEG a year later, it showed no longer seizure potential. And on the right-hand side, he has graduated college, doing well, and wants to go into politics. And that made a believer out of me. That was my pivotal case. And I have to tell you that my wife urged me to see this young man because his mother had written a letter to me that tugged at a mother's heartstrings. Subsequent to that, I've had other examples of CBD working for seizures. This is Aiden. Aiden's 8 years old, and he was having these episodes where he would suddenly stop what he's doing, stare off, and then a few seconds later come back. And as you can see, the EEG, that's the one I showed you, is very characteristic, 3 per second spike and slow wave focus. So the mother took Aiden to a pediatric neurologist in St. Petersburg, part of Johns Hopkins University, and the neurologist accurately said, "These are absence seizures." And the mother said, "What do we do?" "We treat it with ethosuximide, or Zerontin." The mother looked it up and said, "No, I'm not giving my son that. I want CBD medical cannabis." And the pediatric neurologist said, "Well, the only person I know around here is Dr. Aung-Din in Sarasota." So they brought Aiden to me. So while Aiden was hooked up to the EEG machine, he's having these outbursts of these spike and slow wave focuses, abnormal activity every few seconds. As you can see, I put the CBD on him. And look what's happened 5 minutes later, the seizure focus is diminished, and 8 minutes later, down below, it's almost gone. And he's been seizure-free for now about a year and a half, just on the CBD, doing well. Here is William, who had a frontal stroke and seizures. As you can see, he has the left frontal seizure focus where he was exhibiting right hand numbness, tingling, incoordination, and shaking. And 10 minutes after CBD, that focus is gone. And he's been using it and now is back practicing veterinary medicine, which he was told he would never do again. This is an example of Keaton, who's 7 years old, and he has atonic seizures. The first time he had one, he was riding his bicycle and just fell off. And that's what happens. He suddenly loses body tone and falls down. And the baseline EEG on the right-hand side shows an arrow EEG focus. After CBD therapy, the focus is gone, and he's been seizure-free now 18 months on just CBD twice a day. And the MRI in the middle right there shows a benign tumor called a thalamic hamartoma, which is likely the cause for his seizures. As I told you about the pivotal case for seizures, this was my pivotal case for autism Asperger's. I didn't know much about autism spectrum disorder before this patient, and subsequently I've seen more and more and been convinced that cannabidiol and medical cannabis has a big role in treating autism. This was a 21-year-old patient with Asperger's who had anxiety and impulse control problems and therefore problems with the law. In fact, he was referred to me by an attorney, and I'll explain how that happened. He was adopted by elderly parents who were in their 70s when he was born and diagnosed with Asperger's at age 7. He was tried on Ritalin, Risperdal, Depakote, Lexapro, all without benefit. He attended college for a year. In fact, he was in London going to school, didn't do well, came back to Florida, St. Petersburg, Tampa area, went to technical school, and then dropped out. He tried to live alone without work in Tampa in a bad area of town. He became more and more anxious living alone with no supervision, so he saw a psychiatrist who prescribed Xanax extended release 2 milligrams 2 to 3 times a day for anxiety and paranoia as needed. Well, as I told you, JT was living in a bad area of town, and he was afraid, so he bought a a handgun from his biological mother's husband. Of course, this fellow who sold the gun should have known better than that, but nonetheless, he had the gun. Because of the increasing anxiety, he ran out of Xanax prematurely and started having difficulty concentrating and had suicidal thoughts. He called his psychiatrist, and the psychiatrist said, okay, I'm going to call it into the pharmacist. So he goes to the pharmacy, but the pharmacist denied him the Xanax and said, this is premature. You need to come back in a week. So he returned that same day with a gun after being out over 24 hours with Xanax. And when he was refused again, he said, I've got a gun, and he discharged it into the ceiling just to scare the pharmacist, and he was arrested. He was in jail for 3 months, where he gained 20 pounds eating junk food. Then he was released on bail and started on biofeedback sessions, but on no medications. So he started smoking cannabis, self-medicating for anxiety relief. He was referred to me by his attorney because they were trying to say that he couldn't help his behavior. So I took him on, and on the initial visit, he was very inattentive, would not give me eye contact, was easily agitated, but he was not delusional or psychotic or combative. 10 minutes after a gram of CBD in the back of the neck, he became calm and stated, I'm thinking more clearly. So my impression was autism spectrum disorder, Asperger's, with loss of insight and social skills, with panic attack and encephalopathy from Xanax withdrawal. So my plans were to have an EEG, see what his brainwaves are doing, and consider CBD on a regular basis, and possibly even Lamictal, and to stop self-medication by smoking cannabis. Here is JT's baseline EEG on top. The arrows show normal waves and then suddenly, for a few seconds, bursts of high amplitude sharp waves. Then 10 minutes after CBD, down below, these sharp waves have disappeared. I was able to convince the judge that, and the lawyer and the judge, that this EEG correlated with his symptoms of impulsivity where he couldn't control his behavior, and that's how he acted out, and he shouldn't be therefore held responsible, but should be treated medically. So what is the rationale for cannabinoids in autism? As we said, the human endocannabinoid system functions to maintain health and well-being. Through neuromodulation, the changing and adjusting of things so they exist or function in a balanced or proper fashion and amount. As brain neurochemistry and electrical imbalance is a pathological basis for autism and its symptoms, it appears that medical cannabinoid therapy may be ideal for treating this condition at its core. CBD therapeutic benefits are achieved in this direct effects therapy through activity at neurotransmitter receptors in the skin, nerve endings with direct connections to the brain. The blood-brain barrier is bypassed, which is a source of side effects with traditional systemic drug therapies. You're probably asking yourself, how does that direct effects work? We'll go into that. These are the shortcomings of current autism therapy. We seem to be primarily focused at treating symptoms, which can result in long-term deleterious effects, particularly in young developing brains. For instance, excessive weight gain from neuroleptics, further diminishing self-esteem and increasing social isolation in these kids. Central nervous systems for stimulants for ADD contribute to agitation, anger outbursts, poor appetite, and sleep problems. Benzodiazepines can cause lethargy, cognitive blunting, dependency, and potential for withdrawal seizures and phenomena such as with the JT. Even systemic antidepressants can alter brain chemistry and neurotransmitter upregulation in developing brains with unknown long-term effects. What kind of workup should we do in our patients before considering cannabinoids, either systemically or by direct effects? I believe an EEG should be done, and you should apply the CBD cream, as I do, during the study, because it is helpful to see not just the EEG changes, but the clinical changes, which convinces the patient as well as the family that this is working and should be pursued. If there's focal abnormalities in the EEG, I always like to order an MRI of the brain to see what's going on. Oftentimes, we see patients with symptoms of autism, which are related to brain injury or developmental problems, and we want to know what those are. There should be a complete metabolic workup to include thyroid functions, B12, vitamin D. Vitamin D is essential for immunity and brain function, as is B12, and sed rate, which is a measure of inflammation. You should also get the CBC with differential and complete metabolic profile and liver functions. I usually supplement my patients with methylcobalamin, which is a more biologically active B12, methylfolate, which is folic acid, and N-acetylcysteine, because these nutrients support brain health. And also omega-3 fatty acids have been found useful, as some autism patients are found deficient in these. Then finally, I do like to get neuropsychological testing as a baseline to see how the patient is processing the brain and how they think and how they are programmed in terms of responses. And it's good to have a baseline and after therapy to see the benefits. Let's go now to direct effects therapy with medical cannabis. Direct effects is the delivery that I was fortunate to come across and about 12 years ago, and for which I've been obtained several patents, both in the US and abroad. This is the million-dollar question, as you well know, with cannabinoid therapy. Is there a means to minimize or prevent potential systemic cannabis effects of psychoactivity, dependency, addiction, long-term effects on personality and performance, particularly in children with developing brains and others, while preserving its medical benefits? And the answer is a resounding yes. So what is direct effects therapy using neuroactive drugs, including the cannabinoids? Afghan Pharma is the company that I founded to advance this technology. Direct effects is a groundbreaking topical drug delivery which treats neurologic and psychiatric conditions, including chronic pain, through direct nerve connections without the limitations of blood flow, thereby providing rapid therapeutic benefits without concerns of systemic side effects and drug interactions. In fact, you saw in the EEGs that effects were seen within 5 to 10 minutes. Let's review how we take drugs. On the right-hand side is what we call systemic blood therapy. You take drugs either by mouth, oral therapy, go through the stomach, go through the liver, and then go in the bloodstream, and the heart pumps it to the rest of the body. It goes everywhere. Plus, you have to contend with a blood-brain barrier. The brain is a privileged environment, and there's a blood-brain barrier which prevents certain chemicals from crossing. Or you can inject the drug right into the bloodstream. Nonetheless, you have to have drug in the blood to get to the brain where the problem is. As opposed to that, direct effects on the left-hand side goes right into the brain through nerves at the back of the neck, with direct effects directly on the nerves. How does that happen? When I first discovered this, I said to myself, it's got to be in the blood because that's the way they taught us in medical school. What is the therapeutic blood level? But not necessarily, and I'll explain why. The back of the neck is the critical area of drug application in this delivery because it's where there's modulation of neural input to the brainstem, which is like the grand central station where processing of neural impulses occurs and other central nervous system structures. So BONAF is a term I termed back of the neck of the hairline. It's critical. Why is that critical? If you were to cut away the back of the neck, you'd see the brainstem there in yellow, which is about the size of your thumb, where all nerve impulses from the brain has to go to the body and from the body back to the brain. It's like the processing center. And look on the left-hand side where these nerves in the neck go right into the brainstem. The vagus nerve brings all the impulses from the body to the brain. The trigeminal nerve brings all the impulses from the head and the back of the neck to the body. Let's look at the skin at the back of the neck, or the skin everywhere, anywhere actually. The top is the dead skin layer. And look at the arrow. That is the free nerve ending. Right underneath the surface of the skin is a free nerve ending, which becomes a peripheral nerve, and at the back of the neck becomes a cervical nerve root that becomes part of the trigeminal nerve complex that goes to the brain. Here is a diagram from Wikipedia, believe it or not. And on the left-hand side, you see the skin surface. And right underneath the surface, you see this blue circle, which is a blown up part of the free nerve ending. And it shows that it has receptors that are sticking out of the cell, which can be bound by certain drugs. And as we said, neurotransmission occurs by chemical binding and electrical impulse occurring. What are some of these receptors? What do they bind? Well, there's CB1 and CB2, which binds cannabinoids. There is no nerve growth factor. There's TRPV1, which binds capsaicin, and then there are endogenous agonists, which are serotonin, norepinephrine, dopamine, and such neurotransmitters. What is the free nerve ending? If you follow the free nerve ending, you see that it's part of the dorsal root ganglia of the spinal cord, which is the processing center. So it's part of the spinal cord that has extended into the skin. So these exposed nerve endings become the site of action for this direct effects topical therapy. And on the right-hand side are endogenous agonists. In other words, these are the chemicals that we make that can act on the cell receptors, serotonin, dopamine, norepinephrine. You heard these before, as well as endorphins. Endorphins are what we make that mimic opioids. And endocannabinoids, as we said, are what act as the cannabinoids from plants or synthetic. So if you want to bind a serotonin receptor on the skin nerve ending, what do you use? You use a serotonin agonist like triptan. Triptans are for migraine, and they work for serotonin receptors on the skin. In fact, my first patent was for migraine therapy using triptan cream in the back of the neck. If you want to treat Parkinson's with dopamine deficiency, what do? You use apomorphine, a dopamine agonist, in a cream, applied in the back of the neck, and it provides dopamine release. In fact, that's one of my patents for Parkinson's. There's tizanidine as a muscle relaxant, and as you go down, there is CBD and cannabinoids, which bind the endocannabinoid receptors on the cell membranes. Here is a CB1 and CB2 receptors on nerve cell membranes. And you can see the black arrow and the red arrow is where the cell surface is. Above it is out in the breeze where it can be bound. Below it is inside the cell. And that's where the drugs bind. So as a result of my work, I filed a patent from initial 88 patients, now over 600 patients in my practice. And these were the different conditions that CBD cream treated. And if you look at it, seizures, encephalopathy, which is attentional problems, thinking problems, anxiety and mood disorders, insomnia, spasms, autism, Asperger's, attention deficit, social isolation, thinking problems, peripheral neuropathy, sensitivity to nerves. Those are very much many of these signs and symptoms of autism. And so that's how I began to use this method to treat autism. So what is the place of cannabinoids and direct effects CBD and autism? This is from Autism Speaks. It says, I'm very sensitive to light and sound. You recall that the brain controls all human function, including sensory processing and behavior. So there's some basis for brain dysfunction causing these autism symptoms. So signs and symptoms of autism suggest abnormalities in brain neurochemical and electrical function, which may be reflected in the EEG. In summary then, what is the place of cannabinoids and this direct effects CBD and autism? Well, the endocannabinoid system acts to modulate many aspects of human function, including that of the brain. Direct effects CBD offers a safe potential treatment option without concerns for systemic effects of drug interactions. Systemic cannabinoid therapy with CBD or THC or in combination to capitalize on the entourage effects may be needed in certain cases. And I would recommend oral capsules, drops, or sublingual forms preferred over smoking or vaping for kids. And gummies or candies could also be considered. But the take-home message I want to give you is that we are all wired differently. So therapy must be individually tapered. What is true and works for one individual may not work for another. I want to give you a final example of a success of treatment with cannabidiol in autism spectrum disorder. I'm going to tell you the case of Edward that I followed from age 13 to age 16. As a 13-year-old, he came with agitation, impulsivity, and social interactive problems. He was one of 4 children. Older sister, 16, had ADHD on Strattera. The father had ADD but was not treated. At 18 months of age, it was noted that Edward was not normal. He was having behavioral problems, impulsivity, and these abnormal movements. At age 3, he was diagnosed by a developmental specialist with pervasive developmental disability, autism spectrum disorder. Abilify was given, and later Ritalin, Risperdal, and various antidepressants, including Prozac and Lexapro. Later, as these were not working, his mother said, let's try an herbal approach. And It did not work, and he was asked to leave the private school he was in because of disruptive agitation. When I saw him the first time at age 13 on the initial exam, he was very infantile. He would not give me eye contact, constantly moving on the exam table in awkward positions, easily agitated, speaking very loudly, almost screaming, with a poor sense of appropriate volume control. And I thought, this is going to be a real problem kid. I placed him on direct effects topical Savella, which is an SNRI, serotonin norepinephrine inhibitor, with some benefit. But there was increasing stress at home as his parents were divorcing, and this just added to his problems. So he got agitated at school, hit someone, and he was Baker acted to a facility for 5 days. Lamictal and Risperdal were started to control his behavior. He entered a private school for special needs. Hydroxyzine for anxiety was added, and then for the first time, CBD was started. His grandmother had been using it for pain through my prescription. After 4 months of starting CBD cream twice a day, the family related that he was coming out of his shell, was more socially interactive, and he made the honor roll as freshman in high school. In view of his improvement, I tapered off Risperdal and hydroxyzine, and he remained only on the Lamictal and topical CBD. At his final visit at age 16, having followed him 3 years, he's a junior in high school and doing well. And this is Edward, 16, with his brother and his parents. And he has what I feel has been given a shot for a more successful life. And that is what I believe, that we're here. We may not be able to cure anything, but we want to give patients a better chance to being successful. Now, you're probably asking yourselves, and you've got a varied audience, I'm not sure about cannabis. I'm not sure about marijuana, and I've heard all these things. Well, you've probably heard of lavender essential oil, right? Some of you may have used it. Well, lavender, the active ingredient is caryophyllene. Caryophyllene is a non-cannabis cannabinoid receptor agonist. In other words, the essential ingredient of lavender works on the same cannabinoid receptors that CBD, THC, and medical cannabis works. In fact, I took a picture of the bottle of lavender that my family has around, and look at what it says in the benefits: soothing, normalizing, and balancing. Now, that to me sounds like modulation, which is changing or adjusting to exist or function in a balance or proper fashion and amount. And with that, I will close and entertain questions. For more information, I've put up this slide. You can contact me at my phone number at 941-342-9477 and tell them that you heard me at the webinar, and that you can also email me at raongdin@aol.com. Thank you very much for your attention, and I hope that you were able to learn something tonight.
Thank you very much.
8.
Thank you so much.
Exactly 8. I can't believe it.
Wow, that was perfect. I just took some lavender. I have some lavender oil in my office. Just rubbed it on the back of my neck. So
You did. Good for you. I did a lot.
So we have a lot of questions for you.
Okay.
I'm going to start at the beginning. Some of them are around the same, but a lot of questions about dosing. So let's start with the very first question we got. How do you calculate dosage of CBD oil for children?
Well, again, it depends on how you're applying it, okay? If you're using it systemically, that is by mouth or by ingestion, sublingual, I always say go low and go slow, okay? Maybe 5 milligrams, depending on age, a couple of times a day. But the interesting thing about the direct effects topical is that you can not overdose because it doesn't enter the bloodstream, and it works as a receptor on those receptors, and you cannot overdose, and you'll just have more on their skin. So that's one of the things I've liked about the direct effects topical therapy, is that there's no systemic effects, there's no overdosing. Even then, my patients use it 2 to 3 times a day. But depending on, to answer the question more specifically, it depends on what kind of cannabis you're using, whether it's CBD, THC, or combination. But I would always go low and slow and see how they respond. And invariably, they're going to have other medications on board, and you don't want drug-drug interactions. I heard that most patients do well with CBD and just low amounts of THC. So that's the way I would probably go. Pure CBD first, see how they do, and then perhaps add small amounts of THC. Again, systemically, we don't know how developing brains respond to systemic cannabinoid therapy, so we want to be careful.
Okay, can you clarify what?
I would start tapering off the other drugs.
Well, yeah. I mean, I think a lot of us would like to do that. Get off the pharmaceutical stuff. That's a goal for many parents that I know. But can you clarify direct effects topical therapy? Because you're using this not only with CBD, but you're using it with, for other purposes. So is direct effects a certain carrier that you use that helps to get through the skin into the nerve endings? Can you clarify that?
That's a great question. I developed the technology. Direct effects means using the skin to have direct effects to the brain, bypassing the blood flow. And that area of the neck is critical. So as my patent reads, anybody who uses a neuroactive compound, whether it's CBD or dopamine or serotonin, and applies it as a cream in the back of the neck to have an effect on the brain, violates my patent. That being said, I'm not going to prevent patients from doing that. They can do that for benefit of their loved ones. But the direct effects is really the application of drugs in a certain medium to have the effects. And we do use different compounding medium to deliver the drug to the free nerve endings. There's some proprietary compounding medium that can do that.
So you can't just take anything and rub it on the back of your neck and get that?
No, you cannot do that.
It has to be a carrier of some sort, a cream.
It has to be a certain carrier which delivers it through that top dead skin layer to the free nerve endings.
Okay, so I'm sure the next question is going to be how do we get our hands on that cream?
There are a couple of companies now that are marketing my delivery. One is Canidex, CANNIDEX.com, and the other is Isodiol, ISODIOL. Both these companies have licensed my technology and using CBD, but you can also, call my office and inquire about that, and we can probably send it to you. The reason being, this is not, CBD is from hemp and it's not regulated.
Okay.
So you can go on those two websites, Isodiol and Canidex. They're the two companies currently.
Okay, I'll type that in for everybody so they can see it. Okay, our next question says, are self-injurious behaviors a type of seizure? Can abnormal electrical and chemical brain issues cause self-injurious behavior? Do we know more about specifically what functions are faulty? Is there any research on this?
That's a good question. You don't know until you look and you do an EEG. I was amazed myself, because I used to think EEGs were only to rule out seizures, but oftentimes it reflects abnormal activity, and depending what part of the brain is being activated, certain symptoms can occur. For instance, if I stimulated your temporal lobe, the mesial temporal lobe, you could start hallucinating, and you could start smelling things like burned rubber and so forth that weren't there. Now, that's not of your doing. It's because I stimulated a certain part of the brain electrical activity. So I believe some of this activity that we see in autistic kids, the self-destructive and abnormal activity, can be directly related back to abnormal discharges and neurochemistry. I mean, there are some people, of course, who will willfully do it for attention. And even then, to hurt yourself for attention has to have some sort of basis of abnormality.
Hmm.
I think that's an area of research that really needs to be done.
Okay, our next question is, are there known effects to taking cannabis on a daily, long-term basis for medical reasons?
Are there known deleterious effects to cannabis daily?
Yes.
Again, it depends on the person, it depends on their chemistry, and it depends on their personality. Cannabis has had a bad reputation in terms of addiction and in terms of becoming just a couch potato and so forth. Well, alcohol does not make alcoholics. Alcoholics make themselves alcoholics. There are people who drink alcohol who are not alcoholics. In the same way, there are people who use cannabis, either smoking it or otherwise, who are not addicts or who are not non-productive. They're productive. So it depends a lot on the personality makeup too, and the interaction of the chemical to that person's personality. But
Right.
that said,
I think they were more asking, are there long-term negative side effects to using cannabis on a daily, long-term basis?
I think in the developing brain, one has to be careful because when you use cannabis systemically, either smoking or eating it or by capsule or whatever, it gets in the bloodstream and it hits all the cannabinoid receptors. It's not selective. And so we don't know what that's going to do for the developing brain. So those are studies that need to be done.
Yeah, that was actually another question further on down the line. And I remember talking to my daughter's doctor a few years ago about using cannabis, and he had concern about some research that was out there, about using cannabis for, someone under, say, the age of 16, because it can affect brain development according to some
Well,
studies.
that being said, though, what about the effects of pharmaceuticals? They can have an effect too.
Agreed.
As I said, even the antidepressants can have long-term effects. We don't know what the long-term effects of those are.
And what do you think of the state of research on medical cannabis? It doesn't seem like there's a whole lot of research being done, and
Well,
it's
part of the problem is this: the federal government has deemed cannabis illegal, controlled substance category 1, so we can't study it. We have to get special permission from the federal government to study it. In fact, some time ago, there was only one source for medical cannabis studies from a farm, I believe in Louisiana someplace. So they've definitely restricted it. Um, that being said, there are certain companies like GW Pharmaceuticals who have been allowed to study it. So I'm trying to make sense of that myself, why some companies can study it and some cannot. But put it this way, I think this tide is going to keep going and it can't be stopped. It's a matter of time, and people are going to have to start studying it properly to find out, because there are so many positive potential effects in cannabis.
okay. Next question. This is a long one. We took my son to have an EEG, and it showed normal, but we see him have episodes where he blacks out fully and has extreme rage and outrage, amount of strength, then can't remember what he has done. He's
Sure
diagnosed.
sounds like a seizure to me. This is
Yep.
what I do. As I told you, most EEGs are like 20 minutes. In that 20 minutes, you may not see anything. So in those patients in which I suspect something like that, I do a 72-hour ambulatory EEG, where I hook up the EEG and the patient goes through life for the next 3 days, and we can record events. And I pick up a lot of stuff. I'll make you a bet that the 72-hour will be abnormal on him.
Okay.
He's showing symptoms that are very suggestive of seizures.
And she's continuing by saying he's 6 and he's already maxed out on 6 different pharmaceuticals. He's been on meds since he was 3. Colorado Autism Center says they want to have him because he's unlike anything they've ever seen or heard of. We do give him hemp-derived CBD, and it helps so much. But I think that whole plant would be the best choice for him. What are the steps we can take here in Texas to get us to the correct doctors to help that won't judge us for wanting to treat with marijuana? I don't think you can get it in Texas yet.
Yeah. First of all, I don't know what the law is in Texas, but I do know that I can speak for 90% of my colleagues, medical doctors, are against it. They need to be educated, just like I was. And so you're fighting in a couple of areas. You're fighting the law, you're fighting the state law, you're fighting the federal law, and then you're fighting the opinions of physicians. I've had pain doctors discharging patients because they wanted cannabis and get off narcotics. It's a very sad situation. So, it sounds to me like he's over medicated too. That's too many medications, and it's hard to determine what's side effects of medications and what is the real disease state.
I agree. Okay,
But
then.
he needs an evaluation. I guess he needs to seek out somebody like me who has an interest and can point the person to the right places. And I don't know who in Texas is that. But just
Well,
like that patient, Alan, that changed my mind, was a pivotal case. Just a couple of days visit to me or to some of the other cannabis experts would be very beneficial.
and Amanda, that's asking that question, there's a great group of moms in Texas that are working to get medical marijuana legalized. It's called MAMA, I believe, MAMMA. So you might want to
We have that here in Florida too. We have Canna Moms here in Florida, but mothers can only do so much, and it's just such a desperate situation because you're fighting the front in so many different ways.
Yeah,
So
and
get help
trying,
before the.
right, trying to go legislatively to try to get
That's going to take
medicine.
forever. You know that. The laws are taking forever, so you've got to get help immediately.
Okay. So Amanda, you have the contact information for Dr. Aung-Din. Maybe you should get in touch and see if he can help direct you to somebody. The next question is, what do you think of Charlotte's Web brand CBD oil that's being sold on the internet, and what dosing would you use for a nonverbal child with autism who suffers with anxiety and OCD?
Put it this way, it can't hurt. It can't hurt. I don't know the exact ingredients in Charlotte's Web. Is it just CBD oil? But that
Yeah.
was Charlotte's Web was one of the first to really, come to the surface in terms of benefits. If I had a child like that, I'd be willing to try anything. We've been kind of brainwashed into pharmaceuticals the only way to go, but they have negative effects too.
They sure do.
This is a plant. This is natural, and it works on our own endocannabinoid system.
And she's
Most drugs
also
we use,
asking,
pharmaceuticals, they just block neurotransmitters or stimulate them. But as we said today, endocannabinoids work at different levels. They work upstream of the neurotransmission.
okay. She's also asking, what brand of CBD do you use for your autistic patients? And do you use any CBD with THC for autism?
As I said in one of my last slides, I treat everybody individually. Currently, in my cream, we're using crystalline pure CBD from hemp with an appropriate carrier. We're also using CBD full spectrum capsules as well as full spectrum oil in cream. And then in some cases where additional benefit is needed by adding THC, I've done that as well.
And what's an indicator that additional benefit is needed from the THC? Would that be more focusing on like anxiety and those kind of symptoms?
Usually, sleep is one. Sleep is one thing that THC helps, and appetite and anxiety too. I mean, you get to know a patient and you see an improvement, and then they kind of plateau, and you say, I wonder if we can go better, and that's how you do that. You just add accordingly.
Okay. And to clarify, she's asking, do you use oil CBD or a cream applied to the skin?
I use it's a cream. The oil does not penetrate as well.
Okay. All right, next question. These are great case studies that you've shown. However, can you speak to why CBD does not seem to work for some kids with autism. Are there specific behaviors that respond better than others? And how do you determine how much CBD to give and how much is too much?
Again, that has to be individualized.
Mhm.
I've seen people respond dramatically. I've seen people not respond very much, and you just have to kind of play around, because first of all, we don't know the strains of the different cannabinoid resources that we've gotten, the plants. We don't know the vehicles they're in. We don't know the constituents of the other non-cannabinoid components like terpenes and stuff. So right now, it's still a very inexact kind of science, and you just have to kind of play around it. There's no magic dose like traditional drugs where they've said that this is the dose of cannabinoids,
Yeah,
and I'm hoping one day it'll get to that.
yeah. Okay. How long does it take to see CBD oil benefits in autistic children?
CBD oil by mouth or by cream?
Well, she didn't specify. Let's answer both.
Well, in my experience with my topical cream, which is not an oil, it's water based. Within first of all, I showed you the EEGs and so forth. Sometimes you can see it immediately within 5-10 minutes. There's something going on, and then they respond, and then they can hit a plateau because they've had this problem for such a long time. And then that's when you start adding the other things. Systemically, if you were taken by mouth, depending on the route, or if it's vape or smoked, it can be pretty rapid because the blood levels get in there pretty quickly. But
Hmm.
if it's ingested, it could take a couple of days.
Okay. Not sure if you can answer this, but a question is, with the legality of CBD use, how do you find an appropriate physician?
That's a great one. In Florida, you can go on the Department of Health Compassionate Registry, and it tells you the doctors that are certified, to prescribe cannabis. We have to take a 8-hour test and pass it, and then we get certified. Then you have to. It's a lot of hoops to jump through, but there are a list of doctors in Florida. I don't know how the other states do it, but we have a special registry here, Department of Health Compassionate Registry, and
Okay. I imagine every state is slightly different with that kind
yeah,
of
and
thing.
also you could probably contact Canamoms in Florida, CANNAMOMS, Canamoms, and ask them. They're nationwide, and say who in my state do you know is a proponent of medical cannabinoids.
Okay. Um, let's see. Do you believe pharmacogenic tests would be helpful for the 7 prescriptions my son takes that includes comorbid medical problems of gastrointestinal problems and diabetes? Seems like he's taking too many drugs and suffers from multiple side effects. And can medical cannabis also help him with these physical conditions?
The answer is both yes. I think he's on too many drugs, and I think medical cannabis can. I have a lot of patients with GI problems like ulcerative colitis and Crohn's disease that respond incredibly well to cannabis. In this case, things like GI problems, you have to take things by mouth because it's a stomach problem. For seizures and anxiety and stuff, you can take it as a cream or other means because it's going to the brain.
Yep.
But as far as this pharmacogenetic testing, I think we're in a place where it could help, but I think the discipline is still kind of premature at this point. I know there's some companies that are looking at the structure of different cannabinoids and how they could react with the genetics of certain people and put the two of them together. But I think we're still new in that area.
Okay. This is from Kelly. She's asking, is there a difference between hemp-derived CBD and cannabis-derived CBD?
CBD is CBD, but it depends on what else is involved if you get it from hemp. With hemp, there's going to be more THC in it. I mean, I'm sorry, the other way. With cannabis derived, there's way more THC in it, and hemp. I use hemp because it's more pure CBD source, plus is not regulated. But many people don't understand the difference between hemp and cannabis, and they lump them together.
Right. And as you stated earlier, they're two entirely different plants.
Exactly.
Hemp has no THC, no psychogenic effects. Cannabis does have THC.
Right.
Okay. What are the benefits of direct effect cream versus oil taken by mouth?
Well, as I showed you, direct effects, first of all, there's no blood levels, and the effects are pretty fast, and it's a cream and it's convenient, and it's controllable. Whereas oils ingested and so forth, depending on how the person's GI system is and metabolism, and it could be harder to control. But sometimes I use both methods to treat patients, both direct effects cream as well as systemically.
Okay. And would the medication dosing increase, would the medication increase weight in a person or a child?
I've not seen it. In fact, I've seen the opposite in older people. I've seen them lose weight
All right.
because they've been coming off other medications and so forth, and they're feeling better about themselves and more active.
Okay. When looking for CBD oil, are there certain brands or ingredients to look for or avoid? Where does one get the cream that you use? Again, sorry, that's been asked a couple times. And how often do you apply it?
As I told you, the current sources that you can get are from Isodiol, ISODIOL, and they're out of California, Carlsbad, California, and also Canidex, CANNIDEX. They're out of Colorado, Denver, and they were able to, if you call them and write to them, they're able to sell it to you and mail it to you. Since it's hemp derived, it's legal. Most of the times, my dosing is one pump, which is 1 gram of 3%, which is 30 milligrams, 2 to 3 times a day. That being said, as I told you, you cannot overdose, but I find that certain people respond to one variety better than another. So, but I've not been able to figure out what the difference is in these people, why they respond. One person responds to Canidex better than Isodiol and vice versa. So the bottom line is you got to try it out.
Okay, here's a good question. Do positive effects continue after stopping treatment with CBD oil? Or is it something you have to
Yeah,
continue?
that's a great question. I have found since it's a neuromodulator, it can reprogram the brain. I've had patients who have been able to reduce their dose of CBD as they got better. It depends on the condition.
Mm-hmm.
I've seen that because it modulates and rebalances.
Interesting. Okay, do you have any colleagues in California that see children?
Off the top of my head, I'm sure there are some, and I think Canna Moms, and there's another one, Canna Kids, I think it is. They're out of California, CANNAKIDS. If you look at the website and call them, I'm sure they could direct you to physicians. California's been way ahead of any other state in terms of medical cannabis.
Okay. If a parent wants to try this, sorry, this isn't typed quite right. I'm going to try and figure it out. If a parent wants to try this on, I guess, an adult child with autism, do we need to visit your practice or can you prescribe remotely?
If it's a topical CBD, the direct effects, you can go right online, and it's over the counter. It's not prescribed.
Right.
It's a natural product, so it's not prescribed.
Okay.
Only the THC in Florida and cannabis derived has to be prescribed, and you have to go through. Even then, it's not really a prescription. It's a quote recommendation, but you have to go through all these hoops to get them registered.
Okay.
So it's kind of a funny situation where you're not really prescribing it, but you are recommending, but you have to go through more hoops than prescribing narcotics.
Right. Okay, you had mentioned omega-3s before, and Catherine is asking, would it benefit us to give or take foods and supplements of omega-3 and 6 with children with ASD? And can you recommend a dosage?
Yeah, I would. In fact, there's a colleague of mine who invented some cookies. Okay, his son has autism, and it's called Zack's Snacks, Z-A-C-K Snacks, and his child was not wanting to eat, not only because of consistency, but other things, and he wanted to provide the omega-3s, and he produced these cookies, which kids seem to like, and it also provides omega-3. So you might want to look that online, Zack's Snacks.
Zack's Snacks, okay. Are there any states that restrict CBD?
Well, CBD from hemp, you mean? There are
Sure.
all kinds of different rules, and some people are not even aware of how to interpret them. I had heard that you could not bring into a state hemp CBD, and then I heard that you can grow it in the state that you use it. So each state is different, and it's a total mess in that regard.
It is a
But
total mess.
many attorneys have looked at this, and the general impression, and they're trying to make this more clear. There's some lobbies to try to make this clarify this, to try to make hemp-derived CBD completely legal. But as I said, there are a lot of interest groups who don't want cannabinoids to be used, like Big Pharma and so forth. They have a lot of influence.
Yeah.
So there's all kinds of interest playing into it, which is, to me, it's the most intriguing, situation that I've ever seen.
Okay, next question.
But unfortunately, patients are being hurt from it.
Yes. Our next question
And I
is from
also read that.
Gloria. Gloria is asking, how long does it last per dose typically?
Which one? Cream?
She didn't specify, so yes, let's go with cream.
Well, the cream, most of my patients use it 3 times a day.
Okay.
And depending on the condition, for autism, it probably should be regular 2 to 3 times a day. But for people with pain, once a day or as needed is sufficient. It depends on each case.
Right. And I think I think that you've really stressed that. I mean, this is an individual treatment, and you start low, you go slow, you find the right dose, you find the right medicine. You may need just CBD, you may need to add THC. And I know that there's a lot of questions here that you cannot provide solid answers
Cannot.
to because they're not there. We're not there yet.
Now, this is not a cookie cutter thing. And plus, some of these patients are on all these other drugs, which are complicating things.
Mm-hmm. Right. Okay, next question is there a way to test a brain for dysfunction in brain chemistry to see if there's a deficiency in one certain chemical?
Yeah, some people say you can, but you really can't, okay? Because some people check for serotonin and so forth in the blood, but you can't check in the brain. And even the spinal fluid, it's not really reflective of what's happening at the receptors. So at this point in time, we cannot. I mean, there are things like SPECT scans, which can look at abnormalities in function of the brain, but not neurochemically. But many times, though, you can kind of tell by the symptoms the patient is having that there's a neurochemical electrical imbalance.
Okay. Robin is asking, I want to try CBD for my 19-year-old with PDD and anxiety. I'm worried because I have been told that marijuana can cause psychosis. What can you tell me about that?
CBD, as I told you, treats psychosis. So when you say marijuana or cannabis, you're lumping the whole thing. THC can cause psychosis, but I would do with CBD. And some of the stuff you hear, it's kind of exaggerated to dissuade you from using it. Many of the drugs, if you look at traditional drugs, they say suicidal ideation, psychosis, and it can kill you. So you have to look at the whole big picture of how is your child functioning now, and what risk are you willing to take, considering that things that you're using now aren't working?
Right.
But CBD does not cause psychosis. CBD treats psychosis. In fact, it was used as an antipsychotic drug, shown to benefit it. THC can.
Okay. We have a couple of requests to see if you will make your slides available to the attendees.
It depends. I guess have them contact me individually and what the purpose would be for.
Okay.
Okay.
So the email address for our attendees, Dr. Aung-Din's email address is right up on the screen for you now.
I guess we're half hour. Maybe we should be wrapping it up soon.
Yes, we do. We have a few more. Actually, we have a lot more questions. Let me see if I can weed these out a little bit. Going back to developmental risks on children, Anna is saying that we didn't answer her question. Are there developmental risks on children?
That's the million-dollar question. Whenever you give something systemically or developing brain, you just don't know what it does. We don't know what cannabis would do, what CBD would do systemically, and we don't know what the pharmaceuticals would do. But the other side of that question is, are you willing to not take the chance of treating your child, which could benefit them, or let them continue in their course? For instance, I see people with seizures. Is it better to go ahead and let these kids continue seizing and frying their brains, or to try something that could stop the seizures, but potentially could also have long-term negative effects? Untreated children they're going to have long-term effects.
Right.
But with treatment, you could change their course, because, as I told you, the brain is very plastic, and we only use 15% of it. So there may be a lot of reserve and potential there.
Yeah, I think like anything else, it's really weighing the risk-benefit ratio and deciding if that's something, that you think is going to be worthwhile trying.
And unfortunately, the science is so muddied, and there's so many interest groups trying to muddy it up that it makes it difficult.
It is very difficult to get solid answers on a lot of questions, and I know a lot of that has to do with the lack of research. The next question is about specifically about isodiol, and
Right.
that it has propylene glycol as an ingredient. Is there any consideration to make these creams without toxic ingredients in the future?
Yeah, we're looking at different formulations all the time, but currently I use a lot of isodiols products. We use the pure CBD powder, crystalline powder.
Okay, and what does the propylene glycol do in the isodiol oil?
Oh, I'm not sure in terms of the oil, but the cream that I get from them,
Oh,
it,
sorry, the cream.
it works very well and has no systemic effects.
Okay. Do you treat or consult online to patients living in New Jersey or out of state from Florida?
I mean, I do, but I always say that I like to see patients face to face, because I can get a lot more information. And if you can make a trip for a couple of days, I can set up an EEG consultation, and we be much further ahead. I don't like giving advice over the phone, not seeing patients and examining them.
Okay. Someone's asking if
I'm willing to take calls from doctors who are treating patients if they want advice in that regard, though.
Yeah, a lot of doctors do that, and I think that's a great idea. I would suggest too to the parent to have your doctor call Dr. Aung-Din and have a little discussion. That would be great. We had a question about a child diagnosed with autism in Landau-Kleffner, had a long-term EEG that was deemed normal. However, an MEG revealed epileptiform activity primarily in the perisylvian system or region of the brain. We had to travel across the country for the MEG. Would he be considered for CBD treatment with a clean EEG? Would that depend on his symptoms?
This way, I think one of my slides showed that a normal EEG does not rule out a seizure disorder, nor does it rule out an electrical abnormality. So if they're showing symptoms which suggest that, it can't hurt to try treating it as
Mhm.
such.
Okay. Um, I'm sorry. I'm reading. I'm through a lot of questions here. I don't want to.
Maybe
We
what
have
we
a
should
lot
do
of
is we
repeat.
should come back and have another revisit with some of these questions.
Yeah, I think
Another
we're
seminar.
almost to the end. We're almost to the end. We have
Okay.
just a couple more minutes. I think we'll be able to wrap this up. Um, if you don't see any results with use after a few days, should you give up this treatment?
I like to give it a month. A couple of days is not enough.
Okay. Um,
It
cannabis
also
is
depends on what you're seeing as results. I think as lay people, you may be looking for things that are not as objective, perhaps, and sometimes the patient may be responding, but you don't think it's enough or something. That's
right.
where I think neuropsychological testing and professional input is important.
Yeah, and Colleen's making a good point here. She's asking, would being on no other meds be the best scenario, or is CBD more effective with other medications? I mean, I've
That's
always
it
wanted
depends
to
on the
do one thing at a time.
depends on the condition you're treating.
Hmm.
Because for seizures, for instance, you don't want to just take them off all seizure medicine because they could suddenly have withdrawal seizures. So you have to take each case individually. But sometimes, I do what they call a drug holiday. I do that for Parkinson patients where the patients, all the drugs are interacting so much that they're worse off than without anything. So I just wash them out and restart and regroup.
Okay. Um, oh, you got a new patient. Somebody's going to be calling your office. Could CBD help a young child with ADD with no seizure activity? Should CBD be considered before using a stimulant?
I would, and again, I would do a workup because that may tell us. See, ADD sometimes is a kind of a wastebasket diagnosis. People cannot pay attention and not focus because they're having seizures or they're having anxiety or so forth and so on. So I feel like they all deserve a workup. I see many kids who were diagnosed ADD who get worse with brain stimulants because they're having other conditions.
Hmm. Okay. All right. And we're going to make this our last question. It's from Catherine. She says, do insurances cover these treatments?
Unfortunately, natural treatments are not covered, and that's the way things are right now. The drug companies and pharmaceutical companies and insurance companies, they work together to cover things. But I think there'll come a time one day. But currently, no. But there are some traditional companies like GW Pharmaceuticals that are working on CBD, which they hope to pass to the FDA and have it covered.
Well, I hope at some point natural treatments like CBD and medical marijuana will become recognized as the excellent treatments that they are for so many different conditions and will be covered by insurance. But realistically speaking, unless they're being manufactured by a pharmaceutical company, I think it's going to be a very long time before that happens,
Exactly. But pharmaceutical
unfortunately.
companies are beginning to show interest in it, though, because it's going to be an unstoppable, wave.
Right, which the whole patent thing that you talked about, having HHS having a patent on medical marijuana
Right.
doesn't bode well for keeping our medicine clean and organic and
Right.
accessible. And if we're going to have it covered by insurance, it's probably going to be made by pharma, and God knows what's
Exactly.
going to be
Like
in
for
it,
instance,
right?
Marinol. Marinol is a synthetic THC, and it's covered by insurance and has been on the market for years. But you can't use the natural one. I don't understand the thinking there.
Right. Money. Well, it all comes down to money.
Right.
Just like everything, honestly, the biggest lesson I've learned over the last 15 years, dealing with autism. It all comes down to money. So, I think we're going to wrap up the questions from here, and I want to thank you for spending so much time answering all of these questions for us, Doctor. It was really a pleasure to have you with us tonight. For
Thank you so
our
much.
Thank you. For our attendees, if you need to contact Dr. Aung-Din, you can do that at the phone number shown on your screen, and the email address is also listed up there as well. If we didn't get to your question, I'm very sorry. We're just running out of time tonight. I wanted to let you all know that I have been recording this webinar. I will be posting it on the website, nationalautismassociation.org, within the next day or two. Let you know that our next webinar is going to be in 2 weeks on May 4th. We're going to be talking about vision therapy during that one. And one last thank you to you, Doctor, and really, really grateful for you taking your evening off and spending it with us tonight. We appreciate it so much. And to our attendees,
Thank you.
thank you very much to all of our attendees for joining us. And hopefully we'll see you all soon.